Okay, hi and welcome to Synapse. This is Dr. Sonika. In today's video lecture, we are going to talk about lung volumes and capacities along with the flow volume loops. Okay, so let us get started. Yes, the topic seems a little scary and intimidating, so that's why I'm here to make it all simple. Okay, talking about lung volumes, capacities, and finally we're going to talk about the flow volume loop. Okay, so now there is always one or two questions coming from this topic in physiology in your NEET exams, and whether you're taking MRCS or your PLAB exams, so this forms an important part from where you get questions. And also it is important to clear your prof exams to have a better understanding of the lung pathologies. Okay, so without much ado, let's get started. Okay, so now there are certain, see, with regard to this topic, there are a lot of terminologies which are just thrown at you. Okay, when you open your textbook, there are a lot of volumes, capacities and terminologies. When you read, it all makes sense, but when you have to read it again before the exam, or when you start doing your MCQs, that is when you really get confused. Okay, so in today's lecture we will try to understand what every terminology means, okay, and how exactly to go about with the MCQs. Fine, so this is what you can expect at the end of the lecture. Okay, you'll be clear with the volumes, right? So first things first. Okay, so we'll go with tidal volume. Okay, everybody knows this. So tidal volume is the amount of air that is inspired and expired at normal resting condition, right? So now you're sitting, you're watching this video. Okay, so I'm sitting, I'm recording the video. Fine, so what we are doing is we are inspiring and expiring some amount of air, okay, which is at the resting stage. We are not exerting, correct? So that is called tidal volume. So that is around 500 ml. Okay, so this is with respect to males, that is what we normally take. If it is females, it is going to be 300 ml, 350 ml, sorry. So this is in females. So but for all calculation purposes, we take a standard male as the reference, and we are going to take the values for calculation as well. So that is about tidal volume. Okay, so that is clear. So next is IRV. What is IRV? This is inspiration reserve volume. So let us define this. Inspiration reserve volume is, see, tidal volume is what, okay, see, some amount of air that you're normally taking during resting position. Let us say I'll ask you to take a deeper breath. Let's say you're doing pranayam. Okay, so you got to take a deep breath. Okay, fill your lungs completely, how much ever you can. So that extra volume that you can take beyond the tidal volume is called IRV. Okay, I hope I'm clear. So IRV is extra amount of air that you can take beyond the tidal volume. Do not add tidal volume here. Okay, so one logic I want to tell you here is, when they say volume, volume is always single. When you add two volumes, you get capacity. Okay, so IRV is volume, so it is does not include tidal volume. It is excess, that is the excess amount of air that you can inspire beyond the tidal volume, that is called IRV. So this is somewhere around 3000 ml. Okay, fine, I hope that's clear. We'll see with the help of a chart also. So we'll just finish the definitions first. Okay, that is IRV. Next we go to ERV. This is also simple. This is expiration or expiratory reserve volume. Okay, so now the same thing you apply to the expiration part. Yani, so you are normally expiring some amount of air. Okay, let us say again you're doing yoga pranayam where you have to completely empty your lungs. Okay, your yoga instructor says completely empty your lungs. Okay, so you're going to expire excess amount of air beyond the tidal volume. So that is called as expiratory reserve volume. This is somewhere around 1000 ml. Right, fine. So next, the last volume that we are going to talk about is the residual volume. Residual volume. So you know from your physiology basics that lung is never empty. Okay, it can never become completely zero, right? So it has some elasticity, it has some compliance. So there is this play of, you know, opposite forces that act, and at any given point of time, lung is never collapsed. There is some amount of air which is present in the lung at all points of time. So that is called the residual volume. And also basically the definition of residual volume is the air that is that remains in the lung even after a forceful expiration. ठीक है, so tidal volume gone out, ERV is gone out, you've done yoga, so उसके बाद भी there is some amount of air that remains inside your lungs, so that is called as a residual volume. So that is around 1500 ml. So different textbooks give kind of different values. They say 3100. So you know what, just make a round figure and try to remember, makes sense, okay, and it is easier also. Fine. So we have studied the 4 volumes. Okay, quickly, tidal volume was 500 ml, IRV is 3000 ml, ERV is 1000 ml, and residual volume is 1500 ml. So 4 volumes, 4 values, 4 definitions. We have understood the basics, right? Fine. So again, before going to the chart, I want you to learn 2 more terms. Okay, right? So first thing is called as the vital capacity. See, what happens with these, as I told you, that there are a lot of terminologies that are thrown at you. Okay, so now how to remember or how to master this topic is that you understand the components of the term. See, when you said IRV, inspiratory reserve volume, meaning inspiration जितना आप reserve में है, मतलब you don't use it normally. Okay, so you use it when it is necessary, when you're taking a full inspiration. Okay, so those were simple. Now we are coming to vital capacity, right? So let's break the term and we will see the components of this. Okay, vital means what? Vital means something that is alive, that is important. Okay, so let us say agar aap alive ho, something which is living, so we call it vital, correct? So now what is vital for you? Your tidal volume. So to keep you alive, tidal volume is vital. Okay, फिर what is vital? IRV, that is also vital, and also ERV. Can you do something about the residual volume? Is residual volume exchangeable? Can you do something about it? No, it's there. It's like physiological part of the dead space. You can't do anything to RV, so it is not vital. Okay, so understand this, residual volume is not vital, so you don't add it in this definition. So vital capacity is tidal volume plus IRV plus ERV. Okay, so and one more logic I told you, capacity means what? It is addition of, when 2 or more volumes are added, it becomes a capacity, correct? So we are adding 3 volumes here, right? It is capacity, simple, fine. Now we also have another term called FVC. This is VC, that is vital capacity. Then we have forced vital capacity. Forced vital capacity kya hai? The same thing, you are doing it forcefully. You are expiring, you are inspiring full inspiration and expiring forcefully. Okay? That is called forced vital capacity. Simple, nothing difficult in this. Now what the next step? Okay, I am going to take this to the next step. I am going to introduce a term called FEV1. Okay? So this is forced expiratory volume. Okay, let us not introduce the one part right now, so I'll come to the one part later. So let us just try to understand what is FEV, that is forced expiratory volume. Okay, so this forced expiratory volume is the amount of air you are going to expire following a forced inspiration. Okay, fine. So that means it is similar to your FVC definition only, but kya hai, yahan pe you're going to time it. Okay, so you're going to, that is why I wrote 1. So you can write FEV2 as well. That means the amount of air, okay, that you are going to expire, this is in the first second. This will be in the second second. Okay, so now you add all of this, what will you get? You will get FVC, which is the vital capacity, forced vital capacity. So how much of the forced vital capacity you are going to throw out in first second is your FEV1. How much you are going to throw out in the second second is FEV2. How much you are going to throw out in the third second is FEV3. Okay, so I hope you have understood this concept. Okay, so that was about the vital capacity, forced vital capacity, forced expiratory volume 1, 2 and 3. Fine. So now the next term I want to introduce is a TLC. Okay, what is this? This is called total lung capacity. This is also easy. अगेन गो बाय द टर्म. सो व्हेन आई टोल्ड वाइटल, वाइटल मतलब जो एक्सचेंजेबल है, जो essential for life, right? So your TB, IRV, ERV, correct? Even in your sleep you should be able to tell this. Now when I say total, total lung capacity, it is the complete lung capacity. So you're going to add the RV also, right? So the definition of this is this. Okay, so you're going to add everything together, or in other words I can club all the three things here and write it as VC plus residual volume. Make sense, right? So now you know the values of each of this, you can calculate it yourself. So you can, it's actually a range, but if you use the values given in the previous slide, if I say your TB is 500, your IRV is 3000, your ERV is 1000, your RV is 1500, so you put all of this, you get it somewhere around 6000 ml. So you can do the math yourself because now you know the formula, right? Okay. And another last thing which is not very essential for your questions, but they might ask sometimes, is the FRC. What is FRC? FRC is functional residual capacity. Now you will tell me what this is. See, try to analyze. Functional residual capacity means what is remaining behind. So for sure we have RV in this. Okay. Now functional meaning what? You are at rest, you are doing minimal action. Functional meaning every day, day to day, not no exertion, normal routine activity. What will be the residual volume? So you are not taken in a deep inspiration to throughout your ERV. So your ERV is as it is, because the amount of exchange now it is that is happening is only your tidal volume, because you are at rest, right? So hence in at a functional condition your residual capacity is RV plus ERV. Okay, so this can come up only for certain MCQs where they'll say FRC is so and so, but it is not really important for your calculation basis. Okay, so I hope we have I have cleared the different definitions and the formulae. Okay, so let us move on. I just want to show you one of the pictures. Okay, hold on. Okay, just a second. Right. Okay, so look at this. Fine. This is exactly what we have spoken, but in the form of a diagram. Okay, so I will just go ahead here. Here, what have we actually studied? We have studied the tidal volume. Okay, so now let us identify. I'll just write down here: tidal volume, IRV, ERV, RV. Then we studied about the VC. Then we studied about FVC and all the FEV1s here. Okay, then we studied about the TLC and we studied about FRC, correct? So these are the volumes and capacities we have studied so far. Now let us try to understand that with the help of this diagram. Okay, so this is a simple graph where on the y-axis we have the volume of air. Okay, volume of air that is present in the lungs versus x-axis, which is the time. Now look at the tidal volume. So if you take this, okay, this is a baseline. Okay, so that corresponds to a tidal volume, correct? Tidal volume we said is 500 ml. Now look at this, 3000 minus 2500 is 500 ml. So this is a tidal volume. This is what you're inspiring normally, expiring normally, inspiring, expiring. This is what happens normally. Now let's say you start doing pranayam and the instructor says you should take a deep breath. So you take an inspiration, forced inspiration. Okay, so that is your inspirator reserve volume, which is 3000 ml. Okay, this is the extra inspiration that you're taking beyond the tidal volume. Okay, clear? Fine. Now that air you are going to and see, okay, you expire the tidal volume and then you do a forceful expiration. So that is your expirator reserve volume. So this below, how much you can go below your tidal volume. So this was around 1000 ml we already studied. Now what is this? See, you have expired some amount, but some amount still remains now. some amount remains in the lung. Ye lung is not khali, okay, it's not completely empty. So this is called your RV. RV is around 1500 ml. Here it's given to 1200, so it is approximately, you can remember, 1500 ml. Okay, so we have cleared this. So we know this and this. We have seen how to identify from the graph. Okay, now let us see. There is a new term here. What is this? Inspiratory capacity. What did I tell you? Capacity is addition of volumes, correct? So inspiratory capacity kya hai? Tidal volume plus your IRV. Makes sense? Fine, simple. Now coming to functional residual capacity. See this one, functional residual capacity. Now you try to tell me what is the formula of functional residual capacity. Okay, use the logic of breaking down the terms, understanding them, and telling me the formula. Because see, if you try to mug it up, it makes sense. One day you'll remember, second day you'll remember, again during the exam time you're going to forget it. But if you understand the terms, if you break down the components of the volumes or the capacities, then you will remember it for a longer time and you will be able to solve the questions effortlessly. Okay? So FRC was functional residual capacity. Functional means what? TV plus RV. Simple. So that is here. TV plus RV. Okay. So vital, I told you what is vital. Means हमारा तीनों आना है. So it is TV, IRV plus ERV. ठीक है. So everything is involved in vital capacity. So residual volume as it is. And what is TLC? TLC is everything. You include RV also. Correct? So I hope this table makes things very simple. Now you know how to read this, and this is not any more intimidating for you. It becomes easy. Okay. So now let us move on to another important aspect. Okay, so before I show you that, I want to tell you something important. Okay. So when you talk about the lung diseases, right, so you will come across them in your pathology, your medicine. Okay, so what you're going to tell, you're going to divide these diseases as is the obstructive pattern disease and the restrictive pattern disease. Simple. In obstruction, what happens? Okay, let us say this is our normal lung. Okay, as opposed to, let us draw our left lung, which is problematic. In obstructive, what happens? There is an obstruction, so the air, the outflow is obstructed. Okay, so what happens? This lung is going to expand because the residual volume is going to increase because there's an obstruction. Okay, you just imagine there is a tank, there is a cylinder, whatever, so there is a nozzle through which things have to go out. Okay, let us say there's an obstruction in the nozzle, so what will happen? The pressure inside will build up, so this is going to expand provided the tank is made of a membrane, right? So that is what is your lung. So the residual volume will increase. Okay, your total lung capacity will increase because of the obstruction. Okay, now there is an obstruction. Fine. Now let us talk about what will happen to your FEV1. Again, remember, FEV1 was forced expiratory volume. Forced means what? You have to force out something. So you will take a forceful inspiration, then you will do a forceful expiration. That is your FEV, but happening in the first second is called FEV1. Simple. Now you tell me, when there is an obstruction to the outflow, what happens to the force of the volume that is coming out in the first second? Obviously it will reduce now. Correct. If the diameter is reduced or there is an obstruction, so obviously the air coming out will be reduced. This is common sense. So our FEV1 is going to reduce in obstructive disease. Now you have to tell me what happens to FVC. What is happening to the vital capacity? Vital capacity is also reducing. So you'll ask me why? Why? Because see, the residual volume is increasing. Okay. So see, what are the obstructive diseases? First, let me give you examples here. So here is your emphysema, COPD, asthma. So these are the conditions which are obstructive conditions, correct? So in these conditions, what is going to happen? That there is an obstruction to the flow of the air, correct? So as a result, what happens? The air particles will remain behind, more air will remain behind. So what happens? Your residual volume will increase. Right? So when there is already more air in the lungs, okay, you are not removing it completely. Okay. So what happens to your this one? Further, your expiratory reserve or your inspiratory reserve, everything is going to reduce. So your vital capacity is going to reduce. Correct? So your vital capacity reduces. So your forced vital capacity also reduces. Okay, so for people who didn't get, simple, see, when there is an obstruction, your residual volume increases, you're not going to exchange, and there's an obstruction to flow, so more air will remain behind because it's not going out, so it is going to remain behind. So the amount that you can accumulate over that, agar aapka tank khali nahi hai, it's not empty, so amount you can fill inside will be less. Fine, because it's already filled from before. So your vital capacity will reduce. So now we always have a ratio which is called FeV1 to FVC ratio to differentiate between the type of lung disease, correct? So now from here we know this is also reduced, this is also reduced, but if you notice in obstructive diseases, the FeV1 will be reduced more than the FVC. So hence what happens to the ratio? Completely the ratio will finally, the net effect is a reduced FeV1 to FVC ratio. Fine. Now let us go on to the restrictive pattern. Restrictive, see, example is going to be your fibrosis or lung fibrosis, conditions where you have fibrosis. Okay, so now what happens? Fibrosis, so the lung has become small. Okay, you see the difference between this lung and this lung? Restrictive, meaning there is loss of compliance. There is no compliance. Lung will not expand. Fine, because there is something restricting. It's not easily, the balloon, okay, balloon is not, you cannot blow into it because it's a rigid membrane. So it is not, it's not compliant. It's not getting expanded as easily as it should be. So that is the restrictive pattern of the disease. Now you cannot expand this, okay, this is not happening. Now what will happen because of this? What happens to the FVC? Obviously it will reduce because all volumes will reduce here. Your TV is reduced, your IRV, your ERV, your residual volume, everything is reduced. Simple, restrict is very simple because everything is reduced. R for R, everything is reduced. Now you tell me what will happen to the FeV1 to FVC ratio. FeV1 is going to reduce, obviously, because your whole VC is only reduced, correct? So FVC is also reduced. Now this reduction is almost proportionate. So what happens to the overall ratio? It might be normal, or sometimes what happens, your FVC reduction will be lesser, sorry, the FVC reduction will be more. So hence what will happen, your ratio can even be elevated. Okay, the reduction in FVC will be lesser than the reduction in the the FVC reduction will be lesser than compared to FeV1 reduction. So that is why the ratio can be normal, okay, if it's proportionate, or it can be elevated. Okay, because your FeV1 is not so reduced. See, simple, always associate FeV1 with an obstructive disease. Your expiration is obstructed, that's why your FeV1 will reduce. So restrictive, you might not have so much of a reduction in FeV1. So hence the ratio can be normal or it can be elevated, right? So the takeaway from this slide, that is this, okay, obstructive disease, what are the diseases, restrictive disease, what are the diseases, what happens to this ratio. So this is what you have to take away from this slide, okay. So with this I want to show you this slide, okay. So finally we are coming to what is called as the flow volume loops, okay. So okay, let's pick a different color. So we're talking about the flow volume loops. Now if you see this from a physiology textbook, it appears very complicated, like you're going to read some kind of thermodynamics or something like that, okay. So mind you, it is very simple, okay. Now with the concepts that we have learned, let us try to put it here. Look at the purple loop. The purple loop is what is normal, right? So first let us understand the x-axis and the y-axis. So y-axis is, see, it is flow versus volume, right? So your y has to be flow, your x has to be volume, very simple, correct? So flow means what? There is some amount of rate of flow, okay. When you talk about rate of flow, it is always with respect to time, right? So you know it has to be, in lungs it has to be the liters per second, okay. Rate as in time component is taken, so it is per second. Now look at the x-axis, so it has to be volume, so it will be in terms of liters, simple. In this graph, one thing is important that you have to notice, expiration is on top and inspiration is below. Normally we think, aha, first inspiration comes, so I'll write inspiration above. No, Okay, inspiration is always below and expiration above. I'll tell you why. Because see, in this graph it's not very clear. So this will be +8 +4, this will be -4 -8. Minus because during inspiration the pressure is negative and the flow is inside. Just that, the flow is inside. So your direction of flow will be inside, so you take it as minus. So minus means you will be in the lower quadrant. Simple. That's why inspiration is in the lower quadrant. I hope you understood the logic. Right. So let us start from here. Okay, 2. Why are we starting here? Why are we not starting from 0? Because we have to consider the residual volume. So you have 0 to 2 is your residual volume. We understood that residual was somewhere around 1500, right? So that is the amount of volume that is already there in the lung. So you start from this point, okay, and then this is your inspiration. So this direction is very important when you have to mark this loop. So this is the inspiration, the lower part, that is the second quadrant, and this is your expiration. This is how the loop is. Okay, notice the normal loop. So once you notice the characteristics of the normal loop, then you will be able to differentiate, or not differentiate, you will be quickly able to identify that there is something wrong in this. Okay, if there is an abnormality, you will be able to pick up only if you understand the normal. Fine. So we go from here, okay, negative, because the direction of flow is here. We reach a point, okay, that is TLC. You remember what was it? TLC is 6000. Yes, we have reached 6000, that is 6 liters. Again we come back here. Okay, that's it. That is normal. Now let us look at the obstructive loop. Correct? Obstructive is what we read first. Correct? We told that FeV1 is going to reduce, FVC is going to reduce, but FeV1 reduction is more than FVC, so hence the ratio is going to reduce. Now why? And why did we tell that FVC is reducing? Because your RV was increasing. Your vital capacity, everything will reduce because your residual volume is increasing. So your residual volume, it's not starting from 2, it is going to 4. So there is a shift of the loop to the left. Okay, so very important, the loop will shift to the left. Fine, and then your inspiration will appear normal. Look at the expiration part. The expiration part is blunted, it is low, it is altered, it is abnormal compared to this. So you know that this is a problem with the expiration. And look here, this is obstructive, correct? So there will be lower FeV1 to FVC as we have discussed before. Now let's look at the restrictive pattern. Simple. We come here, restrictive, fine. Look at the restrictive part. Here you know that the problem is with everything, all volumes are reduced. Okay, so all volumes are reduced. What will happen? The inspiration is also small, the expiration is also small. So it will be overall a Chuntu loop. It's a smaller loop. Fine. And restrictive as in you are not having enough compliance. You are not inspiring more, nor are you expiring more. Okay, all your capacities are reduced. So hence your vital capacity, your residual volume is also less. Correct? Your residual volume is also less because everything is less. We told R for R, reduced. Fine. So hence your volume will be shifted to the right because it is lower. It is going from 0. So it is this way. Okay, it is opposite. Okay, so that is why it is going here. So it is shifting to the right overall. So the loop is going to shift to the right. Fine, and we see that there is a problem in the inspiration part. It is not going deep. So this is problem with the inspiration, and we know that FeV1 is also reducing, FVC is also reducing. Okay, but they might be proportionately reduced. And FeV1 is not so much reduced as compared to FVC. Hence, your FeV1 to FVC ratio can be normal or even elevated. Okay? So, I hope this part makes sense, right? So, that is it. We have completed the most important parts that you need to know about the lung volumes, capacities, and the flow volume loops. Okay, so this is an important part in your examination. Okay, so do read this topic, don't leave it out because it is difficult, okay, or it is very confusing, because these are the questions that can give you those extra marks and marks that determine your rank. Okay, so next time you see a question on this topic, you are not going to alter your respiratory pattern, right, because everything's under control because you understood this. Fine, so approach the question confidently and you will be able to solve it. So if you still got any questions, do mention it in the comment section below. I'll get to the questions as soon as possible, and I hope this video really helped. I would suggest you subscribe to our channel, click the bell icon, because I'll be posting videos regularly, and I would suggest you favorite this video, or you like this video, because what happens is you will have to revise this topic again. Okay, so the next time you're going to read this, you will recollect it, but you need a revision before going to the exam. So I would suggest you watch this at double speed just before your exams, and all the very best.